Good afternoon, everybody. My name is Dr. Fumi Oluwabi. I'm a pediatrician. Today, we'll be talking about danger signs to watch out for in children. What are danger signs? These are signs that could tell us if this child's life is in danger. I'm going to talk about 3 of them. The first one I'll be talking about is when a child has diarrhea. What is diarrhea? Diarrhea is when a child passes frequent loose stools. So what we have in this situation is the child stools with more frequency. So maybe you have a child who still stools like maybe once or twice a day. Now he's stooling 6-8 times or even more. The stools are also loose. They are not formed. That's what I mean. And some of them can actually be watery. What do? We know that most of the time, in fact, in 90% of cases, diarrhea is caused by viruses. And for those who are under 5, they can have up to 4 to 6 episodes in a year. So it tells you that it's a very common condition in children. When this happens, from mothers that we've seen in the hospital, what we see a lot of times is they go to the patent stores and they ask for things that will make the diarrhea stop. This is all wrong. What you do when a child has diarrhea is to replace what this child is losing. So a child has diarrhea, the mainstay of treatment is replacement of loss, and that is the use of ORS, that is oral rehydration salt. And it's done in such a way now that we have packaged ones that actually also comes with zinc tablets. Zinc is a useful addition when you have a child who has diarrhea. What do we expect you to do? 1 sachet of ORS is mixed with 1 liter of water. I know the standard bottles are usually the 1.5 cl or the 750 cl, 75 cl of water, but we want 1 liter. So what we want you to do is to boil water, let it be clean, and then you look for 50 cl bottles, use them as measurements, or you could actually have measuring cups that will give you a liter. You add 1 sachet of ORS to this mixture, and you can use that for a 24-hour period. What we also hear commonly is the fact that, oh, the children don't like it, they do not tolerate it. That's possible. How can you help your child take ORS? 1, you can buy the flavored ones. These days we have those that are flavored, orange flavored, pineapple flavored. They are in the market, and so you could get this so that we try to simulate what the child can easily identify with. The other thing we can do is to put it in the fridge. We do not want it cold, we just want it cool. The child will find it easier to take fluid that is cool rather than those ones that are to room temperature. Something else you can do to help the child is to give in small volumes. So instead of just putting the cup to the baby's mouth, you can use spoons. You can also use cap covers, those cap drug covers on top of drug bottles. All this will help the child to take your ORS. These babies can also take other fluids. Breast milk, please, if the child is breastfeeding, let the child continue to breastfeed. You can give ordinary water if you cannot give anything else. Water from Gary can also be used, coconut water. These are all useful fluids that you can give to the baby. When do you come to the hospital when a child has diarrhea? When the rate of loss is more than what you are able to get into the child. So you are able to give maybe just half a cup of ORS, and yet the child has stooled 6 times. You know you are not going to keep up with that loss. That child needs to come to the hospital. For children who are also vomiting persistently, they are not tolerating the ORS, then the child needs to come to the hospital. When you see the child starting to get weak, they need to come to the hospital. For the children who also have fever, you need to bring them to the hospital. And that takes me to the second point of fever. It is advocated that every mother should have a thermometer in their house. Not the mercury thermometer, we want the digital one. And you have them come cheaply these days. They come for less than 1,000 naira in a lot of cases. Fever is when the temperature is more than 37.5. When the temperature is more than 37.5 degrees Celsius, what do? Number 1, you expose that child. That means you remove the clothing. Let the child be in pants or just diapers. And then you tepid sponge the child. What we see a lot of times is mothers will just use cold water. Tepid water is warm water. So we want you to get water from the tap and mix it with some hot water, and that is what you use to bathe the child. If you use cold water, the body reacts with shivering. When a child shivers, the temperature goes higher, and then a child can convulse, which is what we are trying to avoid. So please, when a child has a fever, please use warm water to bathe that child. Expose the child. You can put on the fan. You can also put on the air conditioner. Put it on low cold. We don't want it very cold. And you can also give some antipyretics. Paracetamol is something that we all have at home. If all these measures do not work, please bring the child to the hospital. We need to find out why this child is having a fever. I go to the next point, which is an entity that we call febrile convulsion. This is convulsion in a child who has a fever. It is seen in children between the ages of 6 months and 6 years. For those who have a family history, so maybe the mother of the child or the father also had something similar when they were younger, or the child's older sibling has convulsed before, this child can convulse when he has a fever. For those who have convulsed before, they are also more likely to convulse again. What do you do when a child convulses at home? Please and please do not put things into their mouth. We don't want you force feeding them with anointing oil or putting other forms of oil in them. Some will put herbal preparations. Some people will put onion in their eyes. Some people will make them to drink urine, cow urine, or even urine from the mother. And some go as far as putting the baby's legs in fire. Please, these are all measures that we do not want you to take in a child who is convulsing. What do you do? If the child is grinding the teeth together, please don't put your fingers. You can get a spoon and then you wrap it in an handkerchief before you put it between the baby's teeth. What you are trying to do is to prevent the baby from biting the tongue. When a child bites the tongue, it swells up very rapidly and it can actually take over the whole mouth, and that child will not be able to breathe. So you put in a spoon that is wrapped with a handkerchief. Please don't use ordinary metal spoon. It can cause injuries to the sides of the mouth. You can also use the ice cream wooden stick. That's also acceptable. But please don't put your hands, they can bite you. The other thing we want you to do is to put these babies on their sides, preferably on the left side. This is because we know babies who convulse or children who convulse can actually vomit their food. When they do this, they can choke on their vomit. So we don't want you putting them on their back. We don't want you putting them face down. When you do this, they can choke on their vomit and die. So please put them on their sides, preferably the left side, and then be on your way to the hospital. Thank you very much.